Hey everyone! For my topic of discussion today, I have a very exciting dental hygiene question. How about brushing your teeth with warm or cold water? This is really a stupid argument, but some legitimate points can be made in favor of either temperature. Let's start with cold water. Here, the major advantage is the freshness. A blast of cold first thing in the morning can give you an awakened feeling to start your day well. Others also assert that cold water aids in the contraction of blood vessels in your gum, thus minimizing bleeding and inflammation. Therefore, if you suffer from sensitive gums, then drinking cold water can help as a remedy. Although, this cold water is likely to cause a few inconveniences to your oral health. Firstly, if you have tender teeth, it becomes very discomforting. Some people might experience toothache/pain related to the temperature shock. Cold water does not dissolve plaque well, and so you will be required to brush for long minutes and vigorously just to feel that your teeth are clean. Now let's talk hot water. In this case, the big advantage is that warm temperatures make it easier to loosen and wash away plaque and debris from your teeth. Hard-to-reach crevices receive hot water better into them. This helps in lifting away built-up gunk. This can help you to brush less frequently but still adequately clean your teeth. If you're blocked up, the steam can go a long way in helping to unblock your nasal passages. Hot water might not be good for your teeth if utilized for too long. Tooth enamel can also be eroded by excessive heat or become irritation of sensitive gums. Also, you have to be careful about the temperature. Warmth may scald your mouth. Finally, when everything has been said and done, so what's conclusion? That would be my prescription. However, use only lukewarm water to brush your teeth. Neither too hot, nor too cold. Warmish is hot enough to kill plaque, but not to damage teeth. Light enough to wake you up but not shock your system, as well as any temperature sensitivity issues is avoided. You can even move up one level more and begin with a warm water and then end with a very cold water rinse. This is the best of both worlds. Warm water clean thoroughly while cold water contract blood vessels, thereby minimize swelling and leave your mouth cooled. Beyond temperature, there are a few other tips I have to get the most out of your toothbrushing. Use a soft bristled brush, and be gentle, using a circular motion. No sawing back and forth. Ensure that you take at least 2 minutes to thoroughly clean all surfaces. Don't forget your tongue. It harbors bacteria too. Rinse with floss to brush off plaque from between the teeth. Do not swallow the toothpaste after rinsing your mouth. Lastly, diet is very important. The number of bacteria and acidic foods and drinks that wear down enamel will be reduced if you cut down on sugary foods and drinks. Not only eating sugar-free and snacks, but also chewed xylitol sweeteners gum can help stop cavities. And that is how I see the much talked about hot versus cold water debate. Kindly inform me on the comments of what is the usual temperature that you apply and the reason. And if you enjoyed this video, then please do like it and subscribe. Watch out for more dental discussions and health tips that will be in your way shortly. Thanks for watching.